All right, let's dive into one of the most important numbers your body produces, something called cardiac output. Think of it as the ultimate performance metric for your heart. It tells us exactly how hard it's working for you every single minute of every day. So you can feel your heart beating, right? But how do we actually put a number on that? How do we quantify the incredible amount of work it's doing, pumping blood through your entire body? Well, it turns out there's a single, really powerful metric for that. And that metric is cardiac output, or CO for short. The idea is actually pretty simple. It's just the total amount of blood your heart manages to pump out in 1 minute. That single number is the master key. It tells us how well oxygen and all those vital nutrients are getting to every single one of your cells. It's basically the main performance readout from your body's own high-tech smart pump. Now, you might be thinking a number this important has to come from some crazy, complex calculation, right? But what's so amazing here is its simplicity. Let's break down the beautiful little equation that gives us this vital sign. Okay, so the first piece of the puzzle is something called stroke volume. Just picture your heart squeezing down for one beat. The amount of blood that gets pushed out with that single contraction, that is your stroke volume. It's literally the volume per stroke, or per pump. And the second piece? Well, this is the one we're all familiar with, your heart rate. It's just how many times your heart beats in 1 minute. You can think of it as the speed of the engine. So you put those two things together and boom, you get this really elegant formula. Cardiac output equals stroke volume times heart rate. It just makes perfect sense, right? The amount of blood you pump with each beat times the number of beats per minute gives you the total amount of blood pumped per minute. And that, right there, is cardiac output. But, and this is where it gets really fascinating, your body doesn't just set these numbers and forget about them. Oh no, it is constantly fine-tuning everything. So let's look at how it masterfully adjusts that stroke volume, the amount for a single beat, using 3 key control dials. So these 3 dials are what it's all about. First up is preload. This is the fill. Think of it like stretching a water balloon before you let it fly. It's how much the heart muscle stretches while it's filling up with blood. Then you've got afterload. This is the resistance. Imagine trying to push water through a really narrow hose. That back pressure your hand feels, that's kind of like afterload. And finally, there's contractility. That's the squeeze, the raw, inherent power of the heart muscle itself. Your body is tweaking these dials constantly to make sure your output is just right. Okay, but this isn't just some cool biology lesson. This number is something that doctors and nurses rely on every single day to make potentially life or death decisions. So let's shift gears and see why cardiac output is so important in a clinical setting. And that brings us to the serious side of things. If cardiac output is the master metric for getting oxygen to your tissues, what happens when that number goes haywire? What does it actually look like when the pump just isn't meeting the body's demands? Well, the picture is pretty stark. When cardiac output is too low, your body isn't getting enough blood flow. That's called poor perfusion. That can lead to things like confusion, cool skin, and dangerously low blood pressure. On the flip side, sometimes the body's demand for oxygen goes through the roof, like with a bad infection or an overactive thyroid. And that can cause a high cardiac output state, forcing the heart to work way overtime. And because it's such a powerful indicator of what's going on, CO guides so many critical decisions in the hospital. It helps doctors define what kind of shock a patient is in. It tells them if a patient needs more fluids. It helps them decide whether to use special drugs called inotropes to make the heart squeeze harder. And it even helps them figure out the right settings on a ventilator. It's a huge deal. Whew, we've covered a lot of ground, from the basic math all the way to its critical importance in the ICU. So let's boil all of this down to the single most important thing to remember. If you remember just one thing from this explainer, make it this sentence. It's the ultra-concise exam line from our source, and it just says it all perfectly. Cardiac output equals stroke volume times heart rate. It's the volume of blood pumped per minute, and it is absolutely essential for keeping your tissues supplied with oxygen. So I'll leave you with this thought. With every single heartbeat, your body is making tiny, automatic adjustments to preload, afterload, and contractility, all to make sure your cardiac output perfectly matches what you need in that exact moment. It's this continuous, impossibly sophisticated balancing act. What does that constant real-time optimization tell us about the incredible intelligence that's just built right into our own biology? It's pretty amazing to think about. Thanks for tuning in.